Welcome back to the Dr. Ridwan Show and to this episode on erectile dysfunction. This segment of this episode on erectile dysfunction is a very special segment because we're going to meet one of our patients who had erectile dysfunction and who had successful treatment of erectile dysfunction. We're going to meet him and meet his wife, and they will share with us their story. So this is something very exciting, and I would like to take this opportunity to welcome you. Thank you very much for being on our show, and thank you very much for being on our show.
Same. Thank you.
So if I may ask you first, how old are you?
55 now.
55 now. And when was the first time when you had erectile dysfunction? How many years ago?
I can say 4 to 5 years.
So you had erectile dysfunction for 4 to 5 years?
Yes. Between any other illnesses like obesity, diabetes, high blood pressure.
Uh-huh. So you had obesity, diabetes, and high blood pressure. How long have you had diabetes?
At least 5 to 6 years.
Okay, and you have been treated for diabetes?
Yes.
And how about your weight? Has your weight been increasing or decreasing? Tell us.
I lost some weight.
Okay.
And then until I get the operation with you, I keep in better shape, I guess.
Excellent. And in terms of the high blood pressure, how long have you had high blood pressure?
At the same time.
Same time. So altogether, you had high blood pressure, you had diabetes, and you had erectile dysfunction for about anywhere from 4 to 6 years.
Mm-hmm. Yes.
Okay. And with your erectile dysfunction, did you try any treatments initially? When was the first time did you go to the doctor?
I can say 3 years exactly that I remember the most. And I were offered these blue pills. I tried once and it scared me. This is not for me. I thought, well, this is the end, and go back to work and then go to sleep and finish until I get worse and worse until I met you, and then things start to get better.
Now, you mentioned that the first time you went to see a doctor was 3 years ago, but your erectile dysfunction started much earlier. So what made you wait 2 or 3 years to open up to speak to a doctor? What stopped you from that?
Sometimes between work and you don't want to talk about this, not even with friends. You don't tell people. You start to think that, well, that's it, and that's it. And that's not the answer until my wife finds your office and we make an appointment, and all of a sudden everything gets better.
So you started looking for him to get treatment?
Because he's complaining he have a problem to the urine infection. He had to be go to all the time to the bathroom. To start with like that. That's not normal, That we needed somebody, not only regular doctor. They need a specialist. That was somebody said you the very good doctor. They give me your address. I will pass by, take appointment. Your secretary, I think they know me because all the time when they ask to the request with the Spanish lady over there, that we started beginning because he's only taking regular doctor. He's not supposed to go into the specialist. That's what we started with. So you take all the tests. All the.
So. When you came also to the treatment of erectile dysfunction and you were treated with the pills and those did not work, you also at the same time were found to have prostate cancer?
Yes.
And how long ago was that?
They find it slightly over a year now.
And how was your prostate cancer treated?
Well, I have all kind of tests done. and went through all the procedures until they find out the best option for me, because it's many options. The best option for me was to take the cancer out, the prostate, and therefore I have to have the implant done by you.
So you had your prostate removed by Dr. David Silver,
Right, yes.
at our hospital at Maimonides Medical Center.
Yes.
And after the successful treatment of the prostate cancer, you had the treatment with a penile implant,
Yes.
for the erectile dysfunction. So how long ago was the treatment of the penile implant?
Well, it's going to be about 9 months, I guess. Or
9 months. So you've had a penile implant now for 9 months. Can you share with us how is it? Is it working for you?
Oh, I'm very happy, I can tell you. Yes,
Yeah.
it really works. Actually, I recommend anybody that don't suffer, don't have to.
In terms of your erectile dysfunction, not only you had the diabetes and the vascular disease, but you also had the radical prostatectomy, the removal of the prostate, and that all affected your sexual function and your erectile function so much that finally you had the penile implant, and you were able to have a good result. So how long, let me ask you, how long after the penile implant surgery did it take you to recover? When was the first time you were able to have sex again?
Well, it's probably 6 weeks.
6 weeks after
Yeah,
the penile implant?
really quick. Really, you can say nothing. Nobody knows nothing that I have like.
And since then, can you share with us how frequently do you use it?
As long as I have a lady next to me. Yeah.
Very nice.
I'm
Well,
ready all the time. Like.
Well, I really must say to you and to you, thank you very, very much in my name, in the name of our viewers, for sharing your story, for being so generous in sharing your story. This is very important for
I understand that, yeah.
for men out there to know about penile implants, to know about the options, especially those who had a prostate removal or had vascular disease or had diabetes and failed medical treatment of erectile dysfunction. The option of a penile implant is a very successful option and can be very satisfactory. I am Dr. Ridwan on the Dr. Ridwan Show, and stay with us for the next and last segment of this episode on erectile dysfunction.